Good afternoon, everyone. My name is Yong Lee, Deputy Director of the Korea Program at Stanford University. I hope everyone is doing well during these difficult times. The Asia Pacific Research Center has been organizing a webinar series that examine the responses to and the impact of COVID-19 in different countries. And today I'm delighted to be hosting a panel that focuses on South Korea. We have two distinguished guests joining us today, both from Seoul, Professor Soonman Kwon from Seoul National University, and Mr. Sang-Hun of the New York Times. Thank you very much for joining us today. So I'll briefly introduce both of our panelists. Professor Soonman Kwon is a professor and former dean of the School of Public Health at Seoul National University. He was the chief of the health sector group at the Asian Development Bank and is the founding director of the WHO Collaborating Center for Health System and Financing. He's a board member of Health Systems Global and is currently the president of the Korean Health Economic Association. He holds a PhD in health economics from the Wharton School, University of Pennsylvania. Mr. Sang-Hun is the Seoul bureau chief for the New York Times, focusing on news on North and South Korea. He worked for the Associated Press for 11 years before joining the Times in 2005. He has won journalism awards for his reports on Korea and Myanmar, including a 2000 Pulitzer Prize. Now, before turning the screen to our panelists, I wanted to set the stage for today's discussion by providing you, our audience, with a few key descriptive statistics on COVID-19 cases and deaths in South Korea. So I'll share my slides. Okay. So this is the daily COVID cases in South Korea. And as you can see here, so on January 20th, South Korea's first COVID-19 case, it was a Chinese national from Wuhan, was identified. And in a few days, weeks later, cases started to surge. But it was the first major surge outside of China, actually. And what's notable is that the surge was relatively short-lived, and South Korea seems to have flattened the curve, so-called reduced new cases, for quite a while now, and it's been hovering around 10 cases per day for some time now. As of today, South Korea has about 10,670 cases and 237 deaths from COVID-19. Now, if you put this in a comparative perspective, I'm just showing some slides of South Korea, the same daily cases over time, South Korea, Italy, and the US here. You can see that Italy saw a rapid increase in COVID-19 a little bit later than South Korea. And daily cases have started to decrease, but has yet to flatten the curve, and the decrease has been a bit slower. In the US, we hope that we're seeing this turning point and then cases starting to decrease as well. So since the number of cases, number of cases are dependent on testing, and testing varies quite a bit across countries, sometimes it's better to examine actual number of deaths in terms of perspective, comparative perspective. So in this slideshow, I'm showing the number of COVID deaths over time. The y-axis is the number of deaths, but it's in log scale. So what this means is the slope of this curve at any point of time indicates the growth rate of death cases. Okay. So what we can see here, and for many countries, this initially the slope is quite high, indicating that the growth rate of deaths were quite rapid. In instances in very early periods, deaths sometimes doubled every day or every other day. But gradually, as time went by, that slope decreases, flattens a bit, and the rate decreases. Now, where does South Korea lie here? It's down here, and you can see compared to the previous graphs, what's noticeable is that it's been pretty flat compared to other countries throughout the whole period of time. So not only cases were flattened, in terms of deaths as well, the growth rate of death has been quite low compared to other countries. So why was South Korea able to flatten the curve faster than most other countries? What were the policies pursued? Are these policies replicable in other countries? And what is the current situation in terms of daily life and economic situation? So with this brief background and these questions in mind, now I'll turn the discussions to our panelists. And I'll first turn the screen to Professor Kwon for his remarks. Now stop sharing now.
Yeah, thank you. Thanks a lot for inviting me. For me, I'll give some comments on three areas related to this COVID-19 responses. First, issue of governance issues, and second, the kind of conventional public health policy measures to respond to COVID. And finally, my third point is on the remaining challenges. I think the first, the issue of governance, I think this is a very important issue in the public response to these pandemic issues, like social capital or trust in governments is essential to mobilize public support for the responses, because one of the most effective measures is the social distancing. For social distancing, we need the cooperation and compliance with the public. Then public is more willing to participate in the social distancing if they have a better trust in the government and government policy. So in that sense, I think Korean government, this government did quite well from the very early stage. Government gave a very detailed briefings about the number of cases, number of deaths, age, regional variations. And for this improved governance, I think Korea learned a lot from the previous failures, I would say. Because about 5 years ago, we had a so-called, I would say, splendid failure in the policy for MERS. MERS is a Middle East respiratory syndrome. And about 5 years ago, Korea had a large number of casual mortality from MERS. Actually, I think at that time, it is one of the highest mortality outside the Middle East. So it's a bit of, I would say, very failure. It's a huge infection in one of the best hospitals in Korea, and there's not complete epidemiological investigation, so on and so forth. So at that time, there's a huge public criticism on the government responses to a big epidemic outbreak. So after that, after the MERS crisis, Korea strengthened the Korea Center for Disease Control, empowered this agency, and employed more epidemiological investigators. So empowered this area of government policy, although we still believe that there is some kind of underinvestment. But compared to the 5 years ago, I think there's a huge development, progress in the government readiness, in the sense preparedness to cope with this type of pandemic. So it's a very early stage. I mean, a very early rapid response is one of the key success factors. Because if we do not respond very early, it's too late to flatten the curve. And also, of course, there are other issues like there are political economy issues, such that at the early stage, like until middle February, there's some debate over whether we should close the border, especially for China. So conservative parties, opposition parties heavily criticized the government not to close, or for not closing the border. But for the government, I think first, Korea wants to keep a good political relation with China. And second, I think, I mean, as an economy still, Korea is an open economy. So border closure is not really regarded as a very effective mechanism for the open economy, and WHO does not officially support this type of protocol. So anyway, so that's the my first comment on the role of trust, transparency, and accountability, and good governance for health policy. That is one issue. Second, the next issue is on, as I mentioned, very traditional epidemiological or public health response to this type of outbreak. First important measure is, I think, testing. Okay, as you know, Korea implemented a mass scale of testing, but I think at the beginning it can be a bit controversial whether we need this type of mass scale testing or whether it is cost effective. But in Korea, the outbreak, huge outbreak in the so-called Shincheonji church cult is a good momentum, because at that time there's a mass infection and government decided to test basically everybody in the list of the church member. So, and it turns out to be quite effective to use this type of mass testing. So it's a testing. So after the testing, we check whether it's infected or not, and then we were able to isolate the infected people. And another very unique element of this COVID is that there are many asymptomatic patients. I mean, even if he or she is tested positive, but he doesn't have any symptoms, but he still can infect others. So because of this asymptomatic patient, this type of testing, early testing, seem to be effective to isolate those infected. And another issue is that, conventional like wintertime flu, there is a so-called herd immunity. So people get some herd immunity at certain level. We don't need to really worry about. But this COVID is a bit unique, such as still there's a controversy over whether the antibody is generated or whether it is lasting enough for enough time, long enough. So with the uncertainty of the nature of this COVID and the uncertainty about herd immunity, I think now is a bit clearer. It's a kind of consensus that we need a mass testing, but at the beginning, it was not. Another factor is a contact tracing. So again, this is related to the failure of MERS, because after the MERS, there's a new law and new policies, and there's a kind of social consensus that we need a very extensive tracing of contacts. So when we found a positive case, then there's an interview with this patient about where he visited, what type of transportation he used, and all those information. But personal interview is not 100% correct because he cannot remember everything. So those personal interview results is supplemented by CCTV, because there's so many CCTV in Korea these days. And credit card use, because it's almost a cashless society in Korea. Everybody uses credit cards, so credit card use. And also use the information about a mobile phone location. So again, this can be quite controversial issue in other countries. So I think it should be based on social consensus. Especially I'm working these days, working a lot on low-income countries. So this type of tracing has some potential to be abused by authoritarian regime. I'm worried about. So, but in Korea, in the case of Korea, it is based on law, and this law is based on social consensus, partly thanks to the previous MERS experience. So this type of testing and contact tracing are an essential element for us, for Korea, not to use the lockdown. if you are willing to, or if you can use the lockdown, complete lockdown, you don't need this type of testing and contact tracing, you just lock down. But if you want to go ahead without lockdown, this type of testing, isolation, and contact tracing is quite effective. And every day, several times per day, each district government provides the information about this patient. Okay, this patient visited these places at what time. So we got text messages very frequently from the government. So if I happen to be in the neighborhood or in the same places with those patients, then people think, okay, then I had better be tested. Another issue is a treatment issue, because as you know, Korea is a universal health insurance system. It's a national health insurance for everybody. So people do not have to worry about this cost of treatment. And also for the treatment and for the testing, if you have traveled abroad or if you have a doctor's recommendation, is ex-ante free. And even if you are not eligible for ex-ante free testing, you get tested, and if you get tested positive, it's free. So cost of testing is very low, and for many people it's free. And even if you pay, is about $150. The cost of testing is low, and cost of treatment, national health insurance pays the majority of the cost, and there's some cost sharing. But even this cost sharing co-payment part is paid by the government, because in case of communicable disease, government pays. Government can use the budget. So if you are this COVID patient, the financial burden is basically zero. Okay. Another one is that Korea has a very strict mandate, legal mandate, that all public and private hospitals providers should join the national health insurance. So it's not a contract-based system, it's a legal mandate, such that about 90% of the hospitals are private. So this private hospital is a part of this national health insurance system. Okay, so there's another very important measure to mobilize public and private healthcare providers. And also, because of this mass testing, we had a huge number of patients around, especially after Shincheonji outbreak. So around that time, we don't have enough hospital beds. So at that time, government decided to use a triage system. Triage means the classification of patient based on severity. So if you are a severe patient, you send them to the hospitals. But if you have a mild patient, then we can send them a special facility. It's not a hospital, but it's kind of some kind of residential treatment facilities, and attended by a smaller number of healthcare personnel. So this type of resource allocation based on the patient's severity is very important. But in the case of Korea, it was possible because there's a huge surge of patients in mid and late February related to the Shincheonji. But you can see Shincheonji, there are many young people. So if you look at the age structure of patients, the Korean COVID patients are younger than the patient in other countries. And that's one of the factors why mortality rate in Korea is a bit lower. We have more younger patients. So these are all public health measures. Now let's move to my final points on the remaining challenges. Well, one challenge is that equity issues, like poor and vulnerable population, and all around the world, you can see that the old people are heavily affected. There's so high mortality from older people all around the world. I think more than half of those mortalities are coming from older people staying in nursing homes, geriatric hospital. So even in Korea, it's similar. It's not as serious as other countries, but we had some cases of mass infection in mental hospital, geriatric facilities. So I think this is a big issue, how to protect is vulnerable population, older people. Another issue is the poor people, because if you work in the large corporation, you can easily work from home. There are many poor daily workers. Daily workers cannot work from home. So this type of how to protect this poor, vulnerable population is a big challenge for us from an equity perspective. And also, I mean, I'm a social scientist. So from a social scientist view, it seems to me all these policy discussions are too much medically driven. I'm worried about. But for me, especially at this stage of Korea, we passed the mass infection period. Now, I think it's time for us to think about this COVID as a social risk. And social risks are everywhere, okay, like a risk from pollutions, transportations. So we cannot make this risk to zero. So if you cannot do it, we need to change our paradigm such that what is the optimum or acceptable level of risk as a society? So for me, I think for this type of decision, we need a two-stage process. One is evidence. So experts should provide evidence on the benefits and costs, but it should be the public, general public, or citizen council, some kind of deliberative discussions, or deliberative democratic approach to discuss the pros, cons, benefits, and costs of different measures. For example, these days, school closure is a big concern in Korea, but I'm a bit concerned because whether we should open the school when, all these type of decisions are driven by medical concerns, how many patients, how many deaths. But there's a huge implications of like a care perspective, like if both parents are working, if the school is not open, if school is internet-based, what is the implications on the parents' burden, care burdens on the society? But unfortunately, this type of decisions are too much driven by medical-oriented concerns rather than broader aspects of social benefits and cost of different approaches. That's it. Thank you. Mike?
I think your mic is off.
Yeah, thank you very much, Professor Kwon. So with that, may I ask Mr. Choe for your remarks now?
Okay, I think Professor Kwon gave us such an excellent summary about what's happening in terms of government policy and disease control efforts. So I will just make a brief comments about what are things are like in Seoul right now. Things are really coming back to normal, although slowly. I mean, South Korea has never been in lockdown. South Korea could control the disease without locking down the country because of its, as Professor Kwon described, with its rapid, efficient testing and tracking strategy. So we can say that even when the outbreak was very severe, the country has been normal more or less. I mean, restaurants were mostly open, and although there were fewer customers if you go in there, and these restaurants used to be closing earlier than usual, but they were open, and the economy was moving on, although it was seriously handicapped. But now, with the caseload decreasing sharply, we see more normalcy in everyday life. And over the weekend, last weekend, for example, I could see a huge crowd of people packing parks and people going hiking mountains around Seoul. So yeah, you see life coming back around Seoul and across South Korea. And there is a sense of relief, especially when people see the curve flattening. I mean, really the number of new cases has been dropping sharply. I think yesterday it was something like a 9, less than 10, and the other day I was going to work for the first time during commuting hour in several weeks, and I was surprised a little bit that how jam-packed the subways were. Although there was one big difference in the scene, everyone was wearing masks, but the subway was jam-packed, and so the fact that everyone is wearing masks, gives you a sense. You can see that there is a sense of unease still in the air, and still there are cases, especially. I think the country is worried about the new cases coming in from abroad. If you look at the figures, and almost half of the new cases every day are people bringing the virus from abroad. Most of them, I think, South Koreans coming back home from the US or Europe. And so I think the government the government has been tightening the border control, basically requiring all new arrivals from abroad to put themselves in a 2-week quarantine. And this actually was one of the things that the government critics demanded the government do in the early stage of its efforts to control the disease. But the government is putting this into practice now. And so I think what the government trying to do is kind of, strike a balance between, they're trying to catch two birds at the same time, I think. On one hand, they are doing everything they can to keep as much of the economy running as normal. I think it's novel thing. It's good decision. A lot of people say that is a good decision given how the economy has been doing badly in the past few years. So this was the coronavirus was really impacting the economy. So I think there was a good reason why the government is trying to keep the economy run as much as possible. On the other hand, the government also is trying to prevent a so-called second wave of the epidemic. I think if you define second wave, I mean, a certain outbreak, a big outbreak of new cases. I think what the government is trying to prevent. So they're trying to strike a balance. While listening to Professor Moon, when he was talking about how South Korean government was winning the trust of the people, a couple of thoughts came to my mind. I mean, he described the situation very well. Just a couple additional minor comments I want to make. One is that maybe we can look at the political context here. The President Moon Jae-in's government came to power after the impeachment of President Park Geun-hye. She was impeached and eventually imprisoned on corruption charges and charges of abuse of power. But a lot of South Koreans believe that her demise began with the sinking of a Seoul ferry, which killed more than 300 people, and most of them were high school students. And it was very unique disaster in that this thing happened during social media, with the social media technology, and people actually could see these kids were dying because these kids were sending out text messages and video clips while ships were sinking. So the national heart was broken basically, and this was a huge psychological scar for South Korea in general. So I think any politician who have watched the demise of a Park Geun-hye government realize that their fate, political fate, really could depend upon how they deal with the national disaster. If they don't deal with national disaster very well, they could be in trouble. I mean, in short, I mean, how they respond to national disaster could make or break the government. And I think Mr. Moon's government has, we can't really read their mind, but I think clearly they had this thing in mind when they were moving rapidly and efficiently to try to control the epidemic. And it has been successful, and it has been very successful. And as you can see from the result of a parliamentary election a week ago, and Professor Kwon said that how South Korea has been prepared, having learned lessons from dealing with the MERS and other epidemic in the past. And that is true. I mean, but also South Korea people have been prepared, I think. If you look at the South Korean history, I mean, it's a country has been constantly in a crisis mode. There has been war and financial crisis, and so I think there's some kind of a collective discipline among South Koreans. I mean, you know, how can you explain why so many South Koreans, almost all South Koreans, almost without exception, wear masks? You know, the government instruction doesn't explain everything. I think this kind of a collective discipline at the time of crisis, I think have explained why South Koreans were so cooperative with the government. Although Professor Kwon said the government has won trust as well, and also all South Korean men do military service, and I think that also has helped explain this type of collective discipline. And I will end here, and I think we can go into some of these points more in detail with the question answers. Thank you.
Okay, thank you very much, both Professor Kwon and Mr. Choe, for those great remarks. So the way we'll organize this from now on is I'm going to ask our panelists several questions related to the remarks that they've made, but also some additional questions. But in the meantime, I will ask our participants to think about questions that they would like to ask to our panelists. And the way to ask questions is to click on this button down there that says Q&A and type in your questions there, okay? So you can think about the questions you want to think of or ask while I'm making some discussions, proceeding with these discussions with our panelists. So first, I want to point out contact tracing, because contact tracing is a major policy, has been a major policy, and in some sense very successful in the case of South Korea. But the trade-off is that it does infringe upon quite a bit of privacy, because we're sharing information. For instance, from my understanding is that you get a text message of a certain individual. Obviously, the name is not anonymized, but the gender, the age, which restaurant this individual went to, at what time this individual went to a movie theater and sat on which seat. So these very detailed movement trajectories are shared with everyone else. So in cases, these raise privacy concerns in many Western democracies, and can hinder the development of these type of policies. So what's your opinion on the contact tracing policy that was implemented in South Korea? And do you have any suggestions on how it could be improved? And both of you can answer either one.
Mr. Chair first.
Okay, I can say that as a reporter, I can describe the general attitude about this privacy issue. Here, I haven't really seen any organized pushback against this government approach to use new technology to help these disease control officials to track the infected people and their whereabouts. And I guess the general sense mood among here is that people are basically thinking that we can surrender some of our privacy in times of a national crisis. I think there is that kind of attitude among South Koreans. But also there are people who are concerned that maybe the government use this type of new leverage to invade upon citizens' privacy, even after the crisis is over. So I think there will be more debates on this issue down the road, I think. There's a lot of kind of rising movement among civic groups about privacy issues, especially with the advent of digital technology in South Korea. So I think this debate will kick in once the national crisis is over, and there will be some kind of pushback demanding the government that the more detailed regulations and the laws, if possible, be implemented so that there will be no unnecessary violation upon people's privacy, I think. Yeah.
Yeah, I agree with Mr. Chair. So as far as I know, that there is a broader public support. If you rely on the majority rule, it will be definitely supported by majority of society. Although I have a personal, I mean, for me as an individual, I'm very cautious about this. And also, as I mentioned, if it is high, if some low-income countries are very supportive of this kind of thing, it can be abused. So my position is that it should be based on a social consensus and acceptability, and which is the case in Korea. But for other countries, there's a lot of contextual issues. So you should be very careful about it. One recent development is that there was some suggestion such that whether we use a further restrictive measures like what is this? You can not a ring, but
Wristband?
a ban.
Yeah.
So because there are some cases that those who are supposed to be quarantined, self-quarantine, but they left their mobile phone and go out. There are a few instances. So there are some discussions whether we should use a kind of a more restrictive measures, but it was dismissed by so far. So the kind of consensus is that if the self-quarantined person had a record of violation, okay, then we may consider this banned, but banned is too much. So I think the policy should be based on this type of social consensus.
Okay, well, sounds good. One thing that's happening regarding contact tracing now in the US is that the governments, local governments, federal governments are actually thinking about adopting this in the US going forward. Google and Apple are collaborating with each other to develop new apps and technology. And even here at Stanford, students are developing these new technologies. So what do you think? So you mentioned that South Korea's success in part was due to contact tracing that was implemented at a very early stage, but would it be useful, effective in the US at this point of time or in any other countries where cases have already surged?
I have a short answer. It all depends on the timing. Other than Korea, in other countries, it's too late. Because the aggressive contact tracing, it works if you adopt it from the very early stage. But it's too late. There are too many cases. So I don't think it is effective at this stage. I mean, that's my personal opinion.
I think one thing that the people don't fully understand about the South Korean situation is that if you look at the figures, and the South Korean outbreak was largely contained within one church, one big church, and one province, and almost 50% of known cases are connected to that one church and the city of Daegu and surrounding towns. So we can say that the South Korean outbreak was not as widespread as the epidemic has been in other countries. So yeah, that is, I think, a big difference when you try to kind of translate South Korean experience into other countries.
Okay. So one other question I want to ask is regarding masks, because that's been a big issue in the United States as well. In the US, the government has been going back and forth or changing their stance, initially saying that masks are not really helpful for the public to actually use them. But now the stance is that even certain localities are making masks mandatory for the public. So in the case of South Korea, you mentioned that nowadays people are all wearing masks when they go outside, but has it been the case initially when the outbreak, or even before the outbreak? But why the sudden shift? Was there a national policy mandating people to wear masks, or what triggered people suddenly to wear masks? And is it important?
Well, I think South Koreans were used to wearing masks in recent years because of air pollution. We have what's known here as a fine dust, and it has been increasingly a serious issue among South Koreans, and South Koreans have been wearing masks, and so you can say that there has been a kind of a supply channel of masks in place in South Korea by the time the epidemic hit the country, and there is also this constant public health campaign. If you ride subway, for example, you are bombarded with these public information notices instructing people, advising people to wear masks, and the importance of personal hygiene, and the importance of washing hands and using hand sanitizers. I think this public campaign has also kind of educated and informed people. And it's not mandatory. You can't really punish people for not wearing masks, but I think the government has won the trust, as Professor Quinn noted, and the people have been cooperating. They were not really following the government instructions per se, but they realized that it's important to wear masks to stop, help stop spreading the disease. Yeah.
Yeah, I agree with Mr. Choe that although there is some controversy over the effectiveness of mask, so at the beginning and still, the WHO does not officially recommend the face mask, but I think it is cost effective. At least it is effective for me, if I wear a face mask, it's effective for me not to infect others. So, and also it's not a very expensive one. So I think I can think that it's a cost-effective option. And also, as Mr. Choe mentioned, it's a part of Korean culture these days. We have, when there is a high alert level for air pollution, again, we got a text message from the district government such that today we have a high pollution. So vulnerable population, children, old people, don't go out. If you go out, please don't forget to wear a mask. So we are so used to wearing a face mask. There's no taboo. So like even as the same in China, if you visit China in the winter time, because of this pollution, almost everybody in Beijing wears a face mask. So it's quite, we are used to wearing face mask.
Okay, thank you very much. So I'll have maybe two more questions, but yeah, I should open up the questions. One question is, what I find quite striking about South Korea's policy in this period was that South Korea essentially never closed its borders to foreigners. Even when the outbreak was surging in China, in Wuhan, and South Korea's first case was from Wuhan, China, they didn't really shut down the border. They did have an examination and quarantine policy in place, but basically they allowed anyone willing to come to South Korea to come. And that has been the case till today, from my understanding. Most countries around the world has not done that. Many other countries prohibited South Koreans from entering the country when the cases were surging in South Korea. So it's actually a quite interesting policy, because you mentioned that how to deal with disaster was an important political motivation. But if this was a disaster, a safer policy would have been to shut down border and say, okay, we'll actually limit people from China from coming in for a certain amount of a month or so, or certain countries. But that wasn't the case. I just wanted to ask a bit more about that. What was the real motivation, and how were they able to pull this off despite mounting criticisms from the opposition sides or general public? Mr. Choe?
Well, there was a severe criticism from the political opposition against the Moon Jae-in government for not shutting down the border or increasing border control. And some right-wing people have been demanding that South Korea should have banned Chinese tourists or Chinese visitors from the beginning. And but the government has also been very adamant that I mean, they were also following WHO instructions and advice at the time. I mean, you know, they believed that they could deal with it without shutting down the borders, and have to think about the increasing importance of the relations with China. China is South Korea's #1 trading partner, by far the #1, and South Korea has also been hoping that China could help stabilize political situation on the Korean Peninsula, especially in North Korea. And there's a lot of the interlocking political and economic interest between South Korean government and Chinese government. And we also have to remember that the South Korean economy is so heavily dependent upon exports, and shutting down the borders without countries has not only the practical impact, but also a huge psychological impact as well. I mean, here we have a country where people believe that our economy depends upon the export trading with other countries, and suddenly when they suddenly see the border closed, it may create a real sense of panic, which is not going to help yeah, so I think there is such an attitude behind the government policy. I guess Professor Kwon is an economist. I think he can better explain the economic reason.
No, it's basically, as you mentioned, political economy issue. But I don't support the border closure, as I don't support the lockdown. It's a similar idea, right? So if Korea supported the border closure, that means when Shincheonji outbreak happened in Daegu and Gyeongbuk area, we should lock down the whole area. Do we have to? I don't think so. So it's in a sense self-contradictory. That okay, we should close the border, but okay, we don't have to close this Daegu Gyeongbuk area. It's the same because it's the same idea. So why these days this kind of pandemic is so much of a global health security issue? Because of the travel, people's mobility. We cannot lock down, or even if we can lock down, it's against our value. It's against our overall system now. So I think we should be a bit consistent. That's what, if a person say in Korea, if a very conservative politician says, okay, we should close the border with China, then he should support the idea of lockdown the whole region in Daegu Gyeongbuk, but he's not. So it's self-contradictory. It's the same. When many people are, doesn't know, even in the university, around the time that when our semester begins, like early March, many people say we should block the Chinese students coming back to attend the semester. But many Koreans still don't understand that we have more Korean students, even more Korean students studying in China. So if we close that, there are many Korean students who can't study, who can't register in the semester in the Chinese university they are studying. So we should think about this reciprocity. And we should not forget this, the nature of Korean nature is an open economy. I'm not a very open market supporter, but I think these days, especially like Korea is an open economy, we have many entry points. It's different from Singapore and Taiwan. And also Taiwan, I think if the current Taiwanese government is a different government, like if the Taiwanese government is a pro-China government, they would not they would not close the border. So there's always a political economy concerns with this, like a border control and communicable disease.
Okay, yeah. Well, thank you very much. So what I'll do is we have some time for Q&A, and I'll try to go through as many as possible. So for the Q&A from our audiences, I would actually only ask one of our panelists to answer those, and if possible, more briefly, and we'll go through several of those questions in the remaining time we have. So we have a question from Tom Finger. how did Korea produce enough tests and test processing capabilities so quickly? Maybe Professor Kwon?
Well, I'm not an expert in testing, but yeah, it is very unique such that even in the late January, when there are less than 10 cases at that time in Korea, but government already, Korean CDC and government officers talked with potential producers. So it's quite early. I'm very surprised about that either. And also it is due to, again, related to the past experience of MERS. So after the MERS, government think about, in a case of emergency, government is willing to provide a fast track approval for the production. So there are multiple producers, and then, as I mentioned in the Sincheonji issue, government realized that we need to produce a lot of test kits. I mean, that's all my understanding. And also, I've heard, I'm not as I said, I'm not an expert technically in that area, but I've heard if you have some technology in that area, it doesn't take a lot of time and scale to produce large amount of these test kits. That's what I've heard.
Okay, so let's go to something more of a social economy. Did something like impulsive buying happen? I guess it means like after the economy sort of opens, did people start going out and go back in terms of purchasing goods to jumpstart the economy? Maybe Mr. Choe, you have insights into that?
Well, I think Professor Kwon can better explain this, but one thing, I don't know, that kind of, yeah, people have been talking about that. They have been saving money, actually. They say that they have been saving money they would have spent if things were normal. But once the country reopens and with the virus gone, there will be huge surge in impulsive spending and everyone going out spending money. I don't know if that will happen or not. It hasn't really happened yet because we're still in the process of the economy slowly being reopened. But one thing I noticed is that there's a huge e-commerce going on in South Korea, and if there's one business doing well is the business of delivering food or other items to homes. So you can see these motorbikes running around in Seoul, delivering all kinds of things. And I heard that there's a surge in the business of home delivery companies. And even when I was down in Daegu several weeks ago during the hike during the peak of outbreak there, all these coffee shops were closed, but many of them were actually migrate to the mobile apps, and they were producing coffee at their places and delivering this coffee for selling this coffee for home delivery through mobile apps. So you can see how people are adapting to create a new kind of business at the time of pandemic. I don't know whether the impulsive spending will happen or not.
Okay.
Yeah, I think this is, you're right, empirical question. There are a lot of uncertainty, but it's quite important for the government policy for basic income or kind of a disaster, temporary emergency relief for the household, because government are thinking about this providing money for all household. So we hope that the household will spend it and that it will contribute to the overall economy. But there are some research concerns such that with this money, instead of impulsive consumption, some households are more worried about the future and they save it. Then in that case, it doesn't contribute to the boosting the economy as government think about. Yep.
Okay, next question from Karen Eggleston. Professor Kwon, is there any evidence regarding limited or postponed treatment for other medical conditions during this crisis?
Actually, good question. There's a very interesting research topic that many of us are thinking about in the near future. Once this crisis comes down, but my guess is that there should be, because people are paying too much attention on these COVID patients, then there seems to be some kind of negative spillover effect on the healthcare utilization of people who have other types of disease, severe diseases. So there should be some kind of crowding out effect going on, we think, but we don't have any empirical evidence yet. But it's a very important research question.
Okay. So a few more questions. We have time for several more. So this is from Chung-Wan Kyo, I believe, Professor.
Hi, Dr. Jung.
So far, the statistics look good in terms of incidence and mortality, but with outside international risks, and those still remain, when and how can Koreans get back to normal? And maybe what are there any possibility for another surge, or are you concerned about that?
I think that, as Mr. Choe mentioned, if you live in Seoul, if you go out, you couldn't see any different. People go out, So because we don't have any, I can say we had a really minimum level of restrictions so far. But now government formed a committee. It's called Sang-Hun Choe committee. I don't know how to translate it in English, but it's a committee to discuss about exit strategy. Okay, so this exit strategy Korea is facing is not as serious as the other countries, because other countries will exit from a lockdown. But basically, we are exiting from a non-lockdown situation, but still we need some kind of strategy. So initially, government thought about easing, reducing restrictions last week, but because of Easter, many churches members gathered for Easter, plus we have a general election. So government, Ministry of Health and Welfare is worried about increased mobility during the time. So there's a kind of consensus that, okay, let's postpone 2 more weeks. Let's wait for another 2 weeks and then see whether we should really lift any restrictions so far. But as I mentioned, I'm a member of the committee. I'm not really fully agree with that decision. I'm one of the minority in the committee, such that I think we can go a bit more progressively, such that all those decisions are based on how many new cases, how many fatality, rather than broader socioeconomic benefits and costs of different restrictive measures. So that's why what I mentioned in my comments, that we should view this as an acceptable social risk. We cannot make this risk of COVID to zero. Never happens. So we should be willing to ready to the second wave. So what I think is that many of those medical team think that we should make sure that the second wave doesn't happen, but I'm not sure how realistic it is. What I think is that we should be ready to cope with another instance, rather than try best not to allow the second wave. Nobody knows whether it will happen or not, because still there are churches, there's potential hotspots, and young people gather, they drink together in the bar, or club. All this possible. So it's highly unpredictable. So we should make some kind of, as I meant, social benefits and costs, rather than clinically oriented decisions.
Okay. So I'll post, in the remaining time, I posed 2 questions and you can pick one each. So one is from Frank Schellenberg. Previously, you mentioned MERS provided some preparation for the COVID-19 in South Korea. How much was this preparation just within the government, or how much was it citizen knowledge and awareness of what needed to be done in a pandemic? So that's one question. The other question by Kyu Kin is, if you were to advise the US government now, what would you suggest based on South Korean experience? You can pick either question or both answer. Should we go with Mr. Choe?
Well, I think I don't have any suggestions, because situations are very different. But I think one thing we can learn from South Korean experience is that once you realize there is an outbreak, you have to move quickly and efficiently and mobilize resources as quickly as possible. And that's I think the real key to the South Korean success. I mean, largely successful campaign to contain this disease, and I guess the government also has to win the public trust, as Professor Kwon mentioned. And from the very early stage of this outbreak, people have been wearing masks and people have been practicing social distance from the very early stage, and that I think really made the difference in South Korea. And as we earlier pointed out, both about South Korea did learn lessons from its dealing with the MERS, and the one thing that the South Korean government did in dealing with this coronavirus is that they gathered all these the medical companies in one meeting in late January, and basically said, look, we have to make these test kits as quickly as possible, and this is a problem growing, and we have to mass produce test kits. And so, that kind of decision reflects the fact that government was prepared, and how things are going to look, what things are going to look like when this thing really get bad. So they were prepared. Yeah.
Yeah, I think I've learned that read a newspaper that some states in the U.S. are considering to lift up the restrictions. I think that's a bit too early. That's my first response. And second, I can suggest that what is the fundamental solution? Because this type of COVID pandemic will definitely return with some more variations in the coming years. I think US is really time to seriously think about and implement some kind of free access or access to essential healthcare without financial barrier. So it's still, everybody knows that it's a shame that US does not have a universal health coverage. But so with this instance, it's time to really US citizens, politicians to agree upon, okay, please, no more delay. Let's do something to introduce a universal health coverage. That's a fundamental solution and foundation to cope with this type of health risks.
That's a great point. I fully agree with that, especially in situations like these. So I think we're actually past time, but this discussion can go on, and we weren't able to get to many of your questions. So I apologize for that. But first of all, thank you very much, Mr. Choe and Professor Kwon, in joining in this great discussion. And thank you for your time. It's pretty early in South Korea. It was early in South Korea, but now it's okay. But thank you again for joining. And thank you for the participants to sticking around and asking questions. And I hope everyone stays safe. Thank you. Bye-bye.
Thank you. Thank you.
Stay healthy.